couldn't breathe. Every time I try to walk or do anything ahead of time or fast walking, I just got short of breath.
Meet 85-year-old Bernadine Weidler of Mount Olive. She used to play third base for the Chicago Bluebirds, a professional softball team.
What do I know is different? Yeah. Well, my breathing, for one, that's the main thing.
Recent chest pain and shortness of breath brought her to Dr. Gregory Mishkel at St. John's Prairie Heart Institute in Springfield. He advised her to undergo a non-invasive procedure known as transcatheter aortic valve replacement, or TAVR, which is suited for those who aren't candidates for open heart surgery.
So there's a sort of a list of what we call comorbidities, associated conditions that will increase your surgical risk.
The procedure involves a small incision in the groin with a catheter that's threaded to the aorta through an artery.
We don't make a big incision. The patient's heart is continually beating during the procedure.
The entire cardiac team signed this softball as a keepsake for Bernadine, something she holds very close to her heart.
I feel like a different person. I could breathe.
TAVR helps fix a condition that kills 80% of people in the first year. While the procedure holds a lot of promise, there is an increased risk of stroke.
So if you balance, you say, well, if there's an 8% of risk of stroke, but I'll be alive, versus an 80% chance of being dead, that's probably a risk that a reasonable person would take.
In Springfield, Natalie Sprasio, ABC News Channel 20.